Thank you, Mr. President. I rise to explain my vote. This bill is a continuation of the efforts that we've been engaging in our chamber to address the very real and unfortunately continually growing crisis around maternal mortality. In the United States, approximately 23.5 deaths per 100,000 live births, the worst of any country in the United States, is happening. Also, New York ranks 22nd for the highest maternal mortality rate, and from 2018 to 2020, the New York State Department of Health reported a maternal mortality rate of 19.3 per 100,000 live births. Mr. President, we know that there are a few key factors that drive the maternal mortality crisis, namely poor access to prenatal care, having to miss necessary health care appointments due to cost barriers, skipping necessary health care appointments due to cost barriers such as insurance coverage, transportation, or an inability to take off work to get to appointments. This legislation addresses this issue by ensuring that remote ultrasound scans and remote fetal non-stress tests are covered by Medicaid. Telemedicine, specifically remote patient monitoring, also known as RPM, has been proposed by many as a solution to the maternal health crisis. The American College of Obstetricians and Gynecologists has endorsed the use of RPM services to improve maternal morbidity and mortality, recommending that state Medicaid agencies urge their participating healthcare practitioners to utilize these services where appropriate. And now, while New York State Medicaid provides coverage for RPM services, the guidance is ambiguous for providers, and therefore, services like remote ultrasound scans and remote fetal non-stress tests are not utilized to the extent that they should be. This legislation would clarify and codify in statute these services. Also, other states such as Pennsylvania, Ohio, Missouri have already clarified the utilization of billing for these services. I want to thank the Majority Leader for bringing this legislation to the floor. I proudly vote aye, and I encourage my colleagues to do the same. And I also want to thank the bill sponsor in the Assembly, Assemblymember Paulin, for also bringing forth this critical legislation. Thank you so much.